Welcome back. We've all heard the most recent COVID surge is putting an immense strain on West Virginia hospitals, but what does that mean and what does it look like? Well, WVU Medicine recently gave us exclusive access inside one of the busiest COVID ICUs in the state. Now, before we bring you this important story, we want you to know a few things. Under ordinary circumstances, most hospitals would not grant this level of access, nor would we seek it. The extreme seriousness of the situation led hospital officials and us to come to this conclusion. This information needs to get out to the public. While in the COVID ICU, our staff did not go into any patient rooms and did not interfere with their care. Prior to this airing, WVU Medicine officials reviewed all of our footage to ensure patient privacy. With all of that in mind, Don Gray takes us inside the local ICU at Ruby Memorial Hospital in Morgantown.
On a recent day, this was the only open room in the medical ICU at WVU Medicine's Ruby Memorial Hospital in Morgantown. With a waiting list stretching around the state and beyond, the room, like every other one in the ICU, would soon be home to a very ill COVID-19 patient.
Adult code blue, 8 southeast. Adult code blue, 8 southeast.
So adult code blue is where there is a respiratory arrest, meaning someone's in extremis, unable to breathe or oxygenate adequately, or their heart is stopped. 8 southeast is our COVID floor. So right now what you're hearing is a patient who has reached the limits of what they can do with either BiPAP or high flow, and they're putting them on mechanical ventilation. And whether that's a young person or old person, they're in for a long road.
An ICU full of COVID patients isn't just a Morgantown problem. It's affecting hospitals on varying levels all around West Virginia and the region.
Oh, from all over. I mean, we've had multiple patients all the way from Bluefield. Right? You got to remember, Bluefield now is essentially just a little freestanding emergency room. But they're actually acting as a hospital now, holding patients there, 48, 72 hours, sometimes longer. And all they have is an emergency room. But Bluefield, Berkeley, Beckley, Pleasant Valley, Tays Valley, Greenbrier, Wetzel, they're coming from all over. And part of that is because some of their normal referral places are also full, right? So Wetzel would usually go to Reynolds or to Wheeling. Well, Wheeling also is working really hard, and they have a very sophisticated ICU, but they're now in their 3rd level of expansion of ICU overflow. And they only have so many nurses and physicians too, right? So as those places get saturated, then we can't offload the small hospitals with the really limited resources. And that's where things are. Not to mention, on the back end, the skilled nursing facilities are either full or closed for various issues, and all the long-term acute care facilities where a patient could go for a gradual wean off the ventilator once their severe illness is rectified are completely full. So there's no place for them to go.
We've been hearing from Dr. Allison Wilson. She's one of a few medical professionals in the state who help decide which patients get moved to different levels of care from hospital to hospital.
And one of the biggest challenges that we have in West Virginia is that we don't have a whole lot of large, expansive, or tertiary care centers. And so we really rely on our community hospitals, and in particular the critical access hospitals, to be able to provide initial care for evaluation and stabilization. The state for a long time has relied then on the ability to be able to get patients out of those critical access hospitals and get them to larger community hospitals such as UHC or Berkeley, and then eventually if they need tertiary care, get them onto the larger centers such as WVU at Ruby or CAMC.
Getting patients to the level of care that they need is taking time.
Being able to get those patients to the higher level of care has been encumbered in what used to be a couple of hours is now sometimes 3 to 8 days.
While patients are in the smaller facilities waiting for rooms to open up at larger hospitals, there are challenges. Dr. Wilson says some of the older facilities, like Braxton County Memorial Hospital, were built with smaller oxygen pipes, never intended to care for patients over a long period of time. Meanwhile, Wilson says that at Camden Clark Medical Center in Parkersburg, the demand for oxygen has caused issues keeping that building system properly pressurized.
So we have gotten to the point, not only, well, throughout the whole state really, of really overwhelming the local resources. And I think the brunt of it is really felt on the front end at the small critical access hospitals and small community hospitals. I mean, God bless them. They're working extra hours with very limited staff trying to do the best they can.
And Wilson tells us the issues with hospitals are not just affecting COVID patients.
I hear people say, well, you know, if the people chose to get unvaccinated or stay unvaccinated, then they made their choice, right? But it's not true, right? Only 50% of the people they're calling to transfer are COVID patients. We have a lot of other patients who this is affecting. The dialysis patient, the heart failure patient, the trauma patient, the stroke patient, the heart attack patient. There's really no one who's getting an ICU bed anymore out of caution. Right? All those patients we're now not able to offer that level of care, not just here, but at any of the big centers. And it's really every one of these patients have at least one organ system that's failing, and many of them have multiple organ systems that are failing.
Welcome back. This week we're bringing you exclusive access inside one of the busiest COVID ICUs in West Virginia. Before you bring more of this important story, we want to remind you of a few things. Under ordinary circumstances, most hospitals would not grant this level of access, nor would we seek it. The extreme seriousness of the situation, though, led hospital officials and us to come up to the conclusion that this information needed to get out to the public. Well, in the COVID ICU, our staff did not enter any patient rooms and did not interfere with their care. Prior to this hearing, WVU medicine officials reviewed all of our footage to ensure patient privacy. Just like many other businesses throughout the pandemic, hospitals caring for COVID patients have been dealing with staffing shortages, particularly among nurses and respiratory therapists. As Don Gray explains, WVU medicine officials tell us those shortages have affected levels of care and are taking a toll on the medical professionals who are providing that care.
We are no longer able to expand and have that additional 2 ICUs. In fact, we can't even staff our overflow because we're short on nurses and respiratory therapists. We've lost a lot of nurses, a substantial amount of the workforce, and somewhat up to 20%. We have over 50 open full-time equivalent positions for respiratory therapy here at Ruby alone, which really impacts our ability to care for people.
It's just such a slow road. Everybody is so sick and they're on the ventilator for so long, and they're just not turning around fast enough. And we don't have any open beds, and we don't have any nurses, and we don't have any respiratory therapists, and we need help. We need more staff and more resources, and it's just very frustrating. This is such a long battle.
We asked the doctors, nurses, and respiratory therapists what it's been like working in the COVID ICU throughout the pandemic.
An emotional roller coaster, really. I used to be able to not ever show emotion or anything, and I can admit there was times that I would have breakdowns. I've seen my coworkers have breakdowns. It's terrible.
It's real. It's a real thing, and we see people die all the time. And I don't know why, but over the past few weeks, I've had some kind of heated discussions with people I've grown up with and, friends of friends. And it's unbelievable some of the things that I've heard over the past couple weeks. Arguments of the so-called virus, and it's kind of demoralizing, really, to be honest with you, because we see it every day, and we hear, oh, that's just what you're being told. Like, no, I work here every day. It's me and a doctor. There's no one else telling me anything. I see it. I see the guy that goes from his chair to his bed and his oxygen saturations drop to 72, and he can barely breathe. That's real. That's not fake.
Incredibly hectic and stressful. Everybody's here pretty much has COVID in the medical ICU, and you're running into those rooms after donning a whole bunch of PPE to protect yourself and your loved ones. And it's a big responsibility, and it's an uphill battle, it seems like. This whole entire pandemic, a year and a half doing this, it is starting to feel overwhelming, very stressful. It's kind of hard to see the light at the end of the tunnel. that you've just been battling so hard to get to.
And what's really sad is to see the younger and younger people who, for whatever reason, had, this conception that they would be safe. And I think what really gets to our staff and gets to me is watching the young families and the husbands and wives bringing in children to say their last goodbyes to their mom or dad because they're not going to survive. And it's hard then to walk that back. We're talking 32-year-olds, 45-year-olds. We're not talking, 90-year-olds.
It's definitely hard. It weighs on your heart very heavy. It's one thing to say you got to leave it here at the hospital. Don't take it home with you. It's very hard not to take it home with you. My staff will message me when they're home. How's this patient doing? How do they do? Everybody deals with things differently. It's very, like I said, it's very easy to say leave it at work. When you see what we've seen over the past year, and when you see a lot of younger people closer to your own age being so sick, it makes it very hard to find your why, and why are we doing this if people continue to be this sick and they don't get better. That's very challenging, and it's hard, and like I said, it definitely weighs on your heart every day.
So, how do these ICU workers cope? We found that they each have their own methods.
I'll tell you what I do is I tend to sit on my porch and pet my dog, right? And it does impact things. My kids notice that my temper's a little shorter and that the house isn't as clean. It does take a toll.
I have a small circle of people that let me talk. I'm a talker, so I talk it out. I have a very loving husband that listens to me talk. I talk to my peers. I let my employees talk. I found that helps, is talking about things.
My motorcycle. I love riding. I ride it to work. I didn't ride it today because it rained, but that's my big way to decompress and being outside. So, music.
They also look for moments of hope, like when a patient is healthy enough to leave the ICU.
That is an amazing feeling. I talked a lot earlier about the patients this sick and people dying. Somebody graduating from the ICU is very important because it means they're getting out of ICU. They're getting better, right? That's very important to us. We celebrate that. Like I yelled into the room that you heard me yell in the room to the patient. Congratulations, you're graduating from the ICU. We're excited about that. So that's very important to me. That's very important to my staff to see that, because that means their hard work was worth the effort, right? And it means they were able to help make somebody better. So that is very important, especially at a time like this, that we see a lot of patients that don't make it out of the ICU. So celebrating that as a win and a congratulations to that patient is very important.
Welcome back. This week we're bringing you exclusive access inside one of the busiest COVID ICUs in West Virginia. Before you bring me more of this important story, we want to remind you of a few things. Under ordinary circumstances, most hospitals would not grant this level of access, nor would we seek it. But the extreme seriousness of the situation led hospital officials and us to come to the conclusion that this information is important to get out to the public. While in the COVID ICU, our staff did not enter any patient rooms and did not interfere with their patient care. Now, prior to this airing, WVU medicine officials reviewed all of our footage to ensure patient privacy. And throughout the pandemic, medical personnel have been working to come up with innovative ways to treat the worst off COVID patients. One of those techniques is something called proning. It's not a new treatment, but one that is getting a lot more use in the COVID ICU.
Prior to COVID, we would prone occasionally. It was something that we certainly were familiar with and did, but it was more for bad pneumonia, severe lung bruising after trauma, things. Now it's almost routine, right? So on any day, almost half the patients in here may require proning. And it's a very time-dependent resource.
So what that is we take a patient where you normally lay on your back when you sleep, we lay you on your belly. So your face is down and you're laying in that position. And you lay that position for several hours, like 16 hours. You're on heavy sedation and medications that prevent you from moving, so you can have good ventilation on the ventilator. That takes a lot of nursing care and physicians and respiratory therapists and nurses' aid to help assist with those patients. So what the team is doing in there is they're preparing to place the patient in a prone position. It involves really good communication, and they count. And you'll see them start to do that. There's respiratory therapists at the head of the bed monitoring the patient's airway. And then the whole team of nurses and aides will place the patient on their belly. Our physician stands outside of the room, and usually another nurse will stand outside the room in case of an emergency. A lot of times that's myself or a supervisor or someone to get other emergency equipment if we need it. So as you see, they shift the patient towards the ventilator. They count to 3, lift them up on their side, check everything, make sure everything's in place, and then they lay them on their belly. And that's it. The process does not take a lot of time, but it takes a lot of manpower, as you see. As the patient's heavily sedate, they're not aware of what's going on. And then we move quickly to get them back onto the monitor to check their vital signs again. We did this for one patient, right? So there's 6 staff members in there. When there's, like today, there's 12 patients that we're doing this for in this unit. So that's a lot of heavy lifting for a patient that can't move themselves. So it's more, this type of patient is more manpower to get them in the prone position and get them positioned correctly. And then also making sure we have a physician here in case of an emergency to be able to respond to that. Having here in this unit, having so many patients that we're doing this for, it's a lot, and it's tiring. It's tiring doing that. It's physical labor to take care of these patients, in addition to the mental labor of critical thinking for 12 hours straight that you're working here, and thinking what's next or what's happening with my patient and what do I need to do next for them.
Welcome back. This week we've been bringing you exclusive access inside one of the busiest COVID ICUs in West Virginia. Before we bring you today's installment of this important story, we want to remind you of a few things. Under ordinary circumstances, most hospitals would not grant this level of access, and nor would we seek it. But the extreme seriousness of the situation led hospital officials and us to come to the conclusion that this information needed to get out to the public. While in the COVID ICU, our staff did not enter any patient rooms and did not interfere with their care. Now, prior to this airing, WVU medicine officials reviewed all of our footage to ensure patient privacy. That said, you've heard the politicians and the public service announcements urging you to get vaccinated. Everyone we talked with in the COVID ICU wanted an opportunity to explain why they believe West Virginians should take heed. Don Gray has their thoughts.
The sickest of the sick, the people that aren't getting off ventilators, the patients that aren't getting to go home to their loved ones, don't have the vaccine. So if you love your family, if you love yourself, and you want to help us out, please, 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 please get vaccinated.
I think the average person should be vaccinated because it's safe and it's effective against severe disease. And your choice to vaccinate will protect someone else. And you indirectly then are saving someone else's life, whether that's from heart attack, car accident, or COVID. Right? So your active choice to vaccinate or not vaccinate directly affects whether someone else lives or dies.
What hits close home to me is that the patients are my age. That is very scary because I think I have a whole lot of living left to do. So that's very scary to see people that are my age, in my group, and younger. I've seen patients in my unit that are in their 20s, and that's really scary too, because those people still have a lot of living left to do as well. A vaccine definitely could prevent you from being in my ICU and getting as severely ill as some of these patients are. To me, it makes sense that you would do that for yourself to help protect yourself and protect your loved ones as well.
We all do respect your body, your choice, and the fact that we should all have freedom of choice. However, we also do watch a lot of people die because of that choice. And people think it's just a joke, or they don't take it seriously, like how many ever people outside in the parking lot drinking beer or whatever, 2 inches apart in the bars. Nothing's been canceled this time around. So if you are going to want to go out and do all those things, think about everybody else and get your shot.
The only one thing which has definitely worked is vaccines, because the majority of the patients you will see in the ICU are unvaccinated. And the only really small percentage of vaccinated people you are seeing are those who are severely immunocompromised because they cannot generate the immune response. So I highly encourage people to get vaccine, because that is our answer to this thing, because there's not much therapy available otherwise.
Dr. Wilson has strong words for medical personnel who have not been vaccinated and have or will likely lose their jobs because of it.
The sad thing is, in my eyes, it's patient abandonment. And I know those are strong words, but it's real. The patients need you now. And no matter what you think about COVID, real or not, or don't, they didn't get vaccinated, just let them die, that's just not ethical.
All of the folks that we just heard from would certainly fall under the category of healthcare hero. Dr. Wilson has another definition of a hero.
The people who, to me, the people who were a little skeptical, who finally gained the courage to go and get the vaccine, that's who I think is the hero now.
Week long, we've been taking you inside the COVID ICU at WVU Medicine's Ruby Memorial Hospital in an attempt to give you a glimpse at the strain the latest COVID surge has put on our state's hospitals. Today, we wrap up our series by hearing from some of the ICU doctors and nurses about why they felt it was so important to get this information and images out to the public.
I think getting the word out to people that our state is dying. Our state is dying. And it's not just the older people. Right? There are young people in the state who are dying, or who will have lifelong pulmonary sequelae and not be able to work. Well, it's not just the elderly people, right? We're seeing the 45-year-old, the 32-year-old, right? The people who thought they were invincible, and now it's not so invincible.
Get a clear message to people that, just how serious this is, and it's it's real. It's a real thing. I mean, again, I've heard so many crazy stories, from government conspiracy to it's not real to there's no way to really a real definitive test to prove that you have COVID, you don't. I mean, that's 3 that I've heard over the past couple weeks. So the misinformation is the biggest thing that bothers me. It's kind of hard for me to deal with, because just seeing what I see every day when I work, and I wish I could have like a bring a friend to work day or something.
I love the people of West Virginia, and it's really hard to know each day that we have people that are dying that in the past we could have helped, right? If we had just been able to get people's attention and get them to engage in some positive, whether it's masking or whether it's some of their other choices with attending large parties or the vaccine, which is really the best way to protect yourself and others.